Hey guys, welcome back to my channel. If you are new here or if you don't know, I am Nurse T. This is my channel. I am a labor and delivery nurse and I'm here to give you some information, okay? So today we're going to talk about different nursing degrees. We're going to talk about ADN, we're going to talk about BSN, and we're also going to talk about MSN as well, okay? So we're going to get into all of that just so you can know which degree to go for, or just to help you get an idea of what you might go for, okay? All right, so stay tuned. But before we get started, I want to let y'all guys know that I am a labor and delivery nurse. I am not a doctor. I am not a faculty at a school. There's information that is literally from the internet. So do not take this to heart. Still do your research because some of this information can be wrong depending on what school you go to, okay? Not all information is the same with every school, okay? I'm just giving you what I know and you can go from there. Okay, y'all, so the ADN program stands for Associate Degree in Nursing, and it typically takes 2 years. This can be done at a community college or at a university, depending on your choice. There are a lot of community colleges that are offering it, and so I will look into that. Usually the cost for ADN programs are between $5,000 and $20,000 in total for the entire thing, I guess you can say, to get your degree, okay? So just keep that in mind. Also, too, as long as you have that RN, so once you finish your ADN program, you'll take the NCLEX just like you would for the BSN program, and that will give you your letters behind your name, which is the RN. That is what you need to get a job, y'all. Most people do not look at the degree program that you go through. However, some companies will tell you, hey, you do need a BSN within the next 2-3 years. Okay, so if you take the ADN program, remember to have your job pay for you to bridge to the RN to BSN program, because that is a thing to look into. Okay, we're all about spending money, but also saving money at the same time too. So just keep that in mind, and also keep that in mind when you're looking for your next nursing job or your first nursing job. Okay. All right. So the pros with this one, I'm just looking at my notes. So the pros for an ADN program is that it is faster into the workplace, lower cost, and flexible class schedules. With my ADN program, it was very flexible. I think we only went to school like for lecture maybe once a week, and then we had clinicals too, but we also had like online stuff as well too. So it is a full-time job. But I also was working like a little PRM job at the same time too. So just keep that in mind with the ADN program. As far as cons, like I said, some hospitals do require you to have the BSN degree instead of ADN. A lot of people are transforming into that little segment, but there are still some that do allow you to have the ADN as long as you have your RN license, and then as long as you complete a BSN program within a certain amount of time. So if you have a family, if you have a limited time schedule, if you have flexible schedule for school, or you're looking for a flexible schedule for school, or if you're looking for a low cost school, I believe ADN is the right place to go for you. Just because with BSN, it's a different schedule, different kind of things, and we're gonna get into that in a second. But also keep in mind too, if your hospital is magnet designated, most likely you're gonna require a BSN. So let's talk about BSN. Okay, so next is Bachelor of Science, Bachelor of Science in Nursing. So this degree I also have as well. So this degree is the main one that most hospitals do require people to have. You still go through your coursework, you still take the NCLEX afterwards to get the RN license. But this program is mainly at universities. They do have an accelerated program, which is like 12 to 18 months. Just keep in mind that is fast paced and they do not play around. Okay. But, I did the traditional route and that took about 4 years. In that 4 years, it included the 2 years of my prerequisites as well too. So just keep that in mind. Now this one has a higher tuition rate. So according to Google, it's about 20,000 to 80,000 in total, y'all, for cost of everything. Okay. So if you have loans, cool. Just remember you have to pay those back. If you're going to work out of pocket, you may get to that degree slower, depending on how much money you got saved. Okay, because I don't know how your pockets is looking. But like I said, most jobs prefer you to have a BSN, and they're required for management and advanced positions. So if you want to be a charge nurse, if you want to be a manager or one day a CNO, first you need to get this BSN, okay? Because that will give you to the next stepping stones of your career advancements. So pros and cons. So pros is there's more job opportunities, high salary opportunities. And like I said, you can qualify for leadership roles if that's what you want to do. As far as cons, it is more expensive. And if you don't do the accelerated BSN program, then it is more time consuming as well. It's a longer commitment time. So like I said, it is totally up to you. It's totally up to how your life is panned out, how you want your life to be within these next 2 to 4 years, and how much money you have saved or how much money you plan on spending for school. So yeah. So like I was saying, if you want to work in a hospital setting, if you want to pursue leadership roles, and if you want to eventually go for a graduate nursing degree, then BSN is the best way to go for you. And plus, what does it say? Studies show that BSN prepared nurses are linked to better patient outcomes. That's what it says on Google, y'all. But I don't think so. and that's just my opinion. Let me get real with y'all. I'm an ADN nurse, okay? I did a BSN bridge program as well, so I was taking ADN classes and BSN classes at the same time. Y'all, I left my staff nursing job about a year and a half in to go do travel nursing. And when I tell you everybody loves me in travel nursing, every facility I go to, like, for them to say BSN prepared nurses are linked to better patient outcomes, how can you say that? To be honest, y'all, I don't think that's true. And I think that the degree plan that you go for does not dictate if you have better care for your patients. They need to fix that. I don't like that. Okay, lastly, y'all, we have the MSN program. So the MSN stands for Master of Science in Nursing. This is mainly for the people that want to be nurse practitioners, want to be nurse educators, or want to be like nurse managers. I will say with this degree, you have to have a BSN before you can get into this program. A lot of people recommend it. There may be some schools that don't recommend it. Just do your research because I'm not exactly for sure. But with my program, I did have to have a BSN before getting into this program. So with the MSN, it is 2 to 3 years after your BSN, depending on what pathway you do, because they have NP, nurse educator, administration, and quality and informatics. It will say it is a higher tuition. Sometimes it says, according to Google, it says about $30,000 to $100,000 in total. So just keep that in mind before you do go to graduate school. If you want to pay out of pocket, if you want to take out loans, just keep that in mind. Like I said, there is advancement for job opportunities, like I listed previously. Dang, y'all. Every time I get on this camera, I can't talk. But anyways, as far as the pros, you get higher salary, you get more autonomy, ability to specialize, and that is mainly for the nurse practitioner side because they have like psych nurse, they have like general NP or geriatrics, you know, different types of NP stuff, or even midwifery because I even thought about doing that. As far as the cons, it is expensive and it do require you to have your BSN first, and it is intense coursework, y'all. It's very intense, but it's very doable at the same time too. And don't get into this program thinking you're not going to take clinicals because I'm an administrator. I'm doing the administrative side of graduate school, and y'all, we have clinicals. I love it. I honestly do love it because it gives you a foot in the door. However, being a travel nurse and doing this at the same time, y'all, my pockets is hurting. Dang, I sounded country. But anyways, so I say all of that to wrap up is to say with MSN program, if you want to become a leader in your facility, as far as like a nurse manager, nurse, what is it called? A nurse director, director of nursing, that is the route for you to go. If you want to be an educator, if you want to be a nurse practitioner, MSN is the way for you to go. Just make sure you have your BSN before you get into the program. It is a big commitment, but it is something that you should not rush into. I think that most people should get their experience. However, if you get out of your BSN program, you're like, hey, I'm bored, let's get this degree, then do it, because that's what I did. I'm one of the youngest in my cohort, so yeah, a lot of teachers be like, wow, you're brave, and I'm just like, yeah. But anyways, okay, so I say all this to say, y'all, ADN, BSN, MSN, okay? So ADN is if you're trying to get to the workforce early, if you're trying to just go straight shot, like I need to become a nurse now, ADN is for you. If you're choosing BSN, you're going to have more job opportunities, especially in the hospital setting. As far as MSN, you want to specialize, you want to advance your career, become a nurse practitioner, then that degree plan is for you. Just make sure that you have a BSN before then. Now, this is where I get real with y'all. Do not listen to people that say that you have to do it this way, you have to do it that way. Unless they are an advisor at a school, then I would say listen to them. But if they're not, y'all, then don't listen to them, because whenever you choose a path for your education, it all depends on your lifestyle, your finances, and the way you learn. If you learn fast and you're okay with fast pace, then do fast pace. If you need to like slow it down a little bit, then do just traditional route, y'all. It's like tongue twisters. It is okay, okay? There is no correct path. There is no right path. As long as you get those letters behind your name, we good, okay? We have got to the finish line. So if you have any more questions, or even if you have information that I did not include into this video, put it in the comments, y'all. I want to share this information with everybody. I want to make sure that a lot of people understand the different pathways of nursing, because there's not just one pathway. And that's what I love about nursing so much. But like I said, just like, comment. I will see you guys in the next video. Let me know if y'all want to see any information or anything else. And I am free to make a video, y'all. Okay? But thanks for now. See y'all later.